Hi, in this video we will be discussing basic bathing and skincare guidelines for your newborn. The key takeaways from this video are 1. How often you should bathe your baby and what products to use for bath time. 2. What products to use for your baby's sensitive skin. 3. How to manage diaper rash. And 4. When to call your healthcare provider. So first, let's talk about bathing your baby. Your baby will most likely have had their first bath in the hospital, but now you are home and probably wondering where to go from here. New babies don't need a bath every day as they don't really sweat or get dirty enough for this, and bathing more than needed can really dry out your baby's sensitive skin. So when you first get home, it's actually recommended that you give your baby sponge baths until their umbilical cord stump dries and falls off, which is usually around 1 to 3 weeks of life. Sponge bathing your baby means that you don't completely soak them in the tub. You just wipe them down with a soft washcloth and rinse. Once your baby's cord stump falls off, a good rule of thumb is to bathe your baby 3 times a week until their first birthday. Here are some tips for bathing your baby once their cord stump falls off. Use an infant or tub sink. It's not currently recommended to use a baby bath seat as these can easily fall over, and this puts your baby at risk for drowning or getting stuck under the water. Gather your supplies before bath time. This includes things like baby soap, towels, cups for rinsing hair, and a baby washcloth. This ensures that you can always be with your baby, as it is absolutely essential that you never leave your baby alone in the tub for any amount of time. You should never leave your baby alone in the water. If you have to answer the phone or leave the room for any reason, you need to take your baby with you or have somebody else go in and watch your baby. You should also use warm water and always check the temperature of the water with your wrist or elbow before putting your baby in the water. It is important to prevent the water from getting too warm as this can burn your baby's skin. It is recommended to adjust your water heater to not get above 120 degrees Fahrenheit or 49 degrees Celsius. You should also keep your baby nice and warm. Once your baby is undressed, slowly put them in the water as soon as possible. Place your baby in the water and make sure that your baby's face and upper body are mostly out of the water. 2 inches of water is recommended for bathing your baby. You can use a cup to pour the warm bath water over your baby during the entire bath to keep them nice and warm. You should use a mild soap to help minimize irritation and drying out your baby's skin. A mild soap usually means it's unscented and is alcohol-free. You should dry your baby off and wrap them in a warm towel as soon as the bath is done, and apply a small amount of unscented mild lotion to help keep your baby's skin nice and moist. So now let's talk about diaper rash. There are different types of diaper rash that can occur, but here are some things you can do to help prevent diaper rash and keep your baby's skin healthy. You can change your baby's diapers often. Wet or poopy diapers can really irritate your baby's bottoms, leading to infections or skin breakdown. Use a gentle, unscented wipe when cleaning your baby's bottom and let the skin air dry after cleaning. You can also use a thick, fragrance-free barrier cream with ingredients like zinc oxide or petroleum. A thick layer can be applied to your baby's bottom and can be left on in between diaper changes if it doesn't get visibly dirty. This helps to protect your baby's bottom. And don't put your baby's diaper on too tight, as a super tight diaper can rub against your baby's skin, causing irritation. And now, when should you call your healthcare provider? If your baby's rash isn't improving, even if you are using all of the tips explained previously, this is when you need to talk to your baby's medical provider to see what your other options are. Your baby might need a medicine to help with the rash. You should also call your baby's healthcare provider if they have the following symptoms. If they have a fever in addition to a rash, if you notice that your baby has a rash that looks like pimples, blisters, or oozing crusty sores, or if you notice that the rash seems painful to your baby. So to summarize, your baby only needs 3 baths a week after their cord stump falls off. Use a gentle, unscented soap and lotion, and keep your baby's bottom clean and dry. As always, please call your healthcare provider if you have any further questions, and thank you so much for watching this video.